Hi, Todd Martin here with The Walking Code. I'm going to talk to you today about the scourge of plantar fasciitis. You may be familiar with plantar fasciitis because it is one of the most common causes of foot pain. So you may have had it yourself or at least know somebody else who has had plantar fasciitis. In this video, I'm going to talk to you about the causes of plantar fasciitis, what it is, and what the treatments are that are accepted and whether or not those treatments are effective. Then I'm going to give you my own personal opinion on plantar fasciitis and how you can treat it and how you can prevent it in the future. So what is plantar fasciitis? Classically speaking, plantar fasciitis is considered inflammation of the thick band of connective tissue that runs from the base of the toes to the heel. The plantar fascia looks kind of like a bowstring on a bow and arrow in terms of its relationship to the structure of the bones of the foot. Recently, plantar fasciitis is considered more of a fasciopathy than an itis because it is more a matter of micro tears, damage, and dysfunction in the tendon than real inflammation. How most people experience plantar fasciitis is a sharp stabbing pain in the bottom of the heel near the heel bone, and it is especially worse when people take their first few steps of the day. The pain usually improves after being on your feet for a little bit, but if you're on your feet throughout the day, it tends to get worse. The problem is caused by excessive stressors and tension placed on the plantar fascia tissue over time that lead to these micro tears and inflammation and pain. But why does that happen? There can be a variety of risk factors. One of those would be doing high impact athletic activities like running that of course puts a lot of stress on the plantar fascia. It is commonly thought that structural problems in the feet, such as flat feet, put people at risk for getting plantar fasciitis. Being overweight is considered a risk factor for plantar fasciitis. And also, abnormal walking technique is considered to be a contributor to plantar fasciitis. And if you've already seen any of my videos, you'll know I believe that that is one of the primary causes. I've had a lot of patients with plantar fasciitis over the years. Most of these people were not runners or athletes and were not doing any particular activity outside of the normal routine walking around that they would do every day when they ended up getting plantar fasciitis. And that is why plantar fasciitis tends for a lot of people to become such a chronic problem, because it's very difficult to rest something if the damage is being caused by routine activity like walking, which we can't really stop doing. What are the treatments for plantar fasciitis? There are generally considered to be first line or conservative treatments and then second line treatments, which we do if the plantar fasciitis does not heal up within 6 to 8 weeks. First line treatments for plantar fasciitis begin with rest and activity modification. Stretching is also an effective first line treatment for plantar fasciitis. Other things that can be used for plantar fasciitis include ice, over-the-counter pain relievers, such as Tylenol or ibuprofen, over-the-counter or custom-made arch supports, and weight loss for people who are overweight. Let's look at some of these first-line therapies and what studies have shown as to their effectiveness. The first and most obvious would be rest and activity modification. This is clearly going to be one of the most effective things if an activity involving high impact was what caused the plantar fasciitis. So if you started to train for a marathon and started running 5 miles a day and had not been doing that in the past, causing extra stress on the feet, and that's how you got plantar fasciitis, resting it and modifying that activity is probably going to be most of what you need to get it to resolve itself. However, like I said, many people did not do anything extraordinary to trigger the plantar fasciitis. There is something inherent with the way they're moving and their body structure that's adding extra stress and contributing to the problem. When that is the situation, then prescribing rest and activity modification often can be not very satisfactory of a treatment. Next is going to be stretching. Stretching has been shown in some studies to be up to 85% effective for relieving, in the short term, plantar fasciitis symptoms. Stretches include the runner's stretch, which is going to stretch the gastrocnemius in the calf, and also foot stretches using a towel. One of the other ways to stretch the foot is rolling it on either a tennis ball or a foam roller or other type of ball. For the basic runner's stretch, stand close to a wall with both feet facing straight forward. Step back about 3 feet with one of your legs and push back against the wall while pushing your heel down into the ground with a straight knee. Recommendations for the duration of the stretch vary. Most commonly, 15 to 30 seconds or 1 minute are the recommended stretch durations. Perform the stretch 3 times with a 1-minute rest in between. I have seen recommendations for a 2-minute stretch, but this is much less common. Add a stretch of the lower calf by bending the rear knee. Stretch your foot and calf with the towel stretch. Place a folded up towel over the arch and forefoot and pull back, stretching the bottom of the foot as well as the calf at the same time. Perform this stretch 3 times, holding each stretch for 15 to 30 seconds with a 15 to 30 second rest in between stretches. A good stretch to start your day with before placing any weight on your foot is the ball or foam roller stretch. Place a tennis ball or foam roller underneath your foot and roll your foot back and forth from the heel to the ball of the foot, feeling a good deep stretch in the tissues underneath the foot. Over-the-counter pain medications such as acetaminophen or ibuprofen can be temporarily effective, but don't have any healing properties that really make the problem go away any faster than it was going to go away in the first place. One of the other things that I generally recommend is the use of orthotics. Arch supports can be either over-the-counter prefabricated arch supports, which you can get at any store sized to your shoe, and they're not custom fit, or they can be custom-made arch supports, usually done by a podiatrist. There have been studies done for arch supports showing mild to moderate improvement with plantar fasciitis, and importantly, they did not find any advantage to using custom-made arch supports compared with over-the-counter prefabricated arch supports. And custom-made arch supports are significantly more expensive, running up to $300 or more for a pair, whereas the over-the-counter prefabricated arch supports can be gotten for under $50 generally at a store. Considering the cost differential, if you're going to use the arch supports which are considered mild to moderately effective for short-term relief, you want to use something that's not going to be overly expensive. Now, weight loss is generally considered also to be an effective treatment for plantar fasciitis, but clearly it's not going to be a short-term fix because it takes a while to lose weight naturally, and it's often very difficult for people to lose weight long term. And in my experience, most of the patients that I have who suffer from plantar fasciitis are not overweight. And so there is some other problem aside from the weight, generally speaking, that is causing plantar fasciitis in most people. But if you are overweight, of course, trying to get to a healthier weight can't be harmful. Now let's look at second-line therapies for plantar fasciitis. Second-line therapies are considered ones that would be done if the symptoms are not improving within 6 to 8 weeks. And usually these involve more intensive or invasive techniques. Second-line therapies for plantar fasciitis include physical therapy, injection therapies, extracorporeal shockwave treatment, night splints, and taping. One would be a referral to a physical therapist. This is not necessarily invasive, but does involve a higher level of care. So physical therapists can work specifically with stretches or other techniques that they can use to improve plantar fasciitis symptoms. The next type of second-line treatments would tend to be injection therapies, either injection of cortisone or injection of platelet-rich plasma or injection of dextrose, called prolotherapy. There have been a lot of studies comparing the effectiveness of these types of injection treatments to see if they are effective in the short term or in the long term and how they compare with one another. What the studies have shown is some short-term relief from all of these therapies. The fastest relief comes from cortisone injections. However, the effectiveness of cortisone injections wears off faster than all of the other injection therapies. The effectiveness of cortisone injections tend to be within the first 3 months of treatment and are more rapid than the other types of injection therapy. Platelet-rich plasma and prolotherapy tended to be effective within 3 to 12 months after the injection. The onset of the effectiveness was slower than with cortisone injections, but the duration of the effectiveness was longer. One of the other second-line treatments that's available in some situations is extracorporeal shockwave therapy. This has also been found to be effective in the intermediate range of 6 to 12 months, but often loses effectiveness afterwards. It's worth noting that of the second-line therapies I just reviewed, only physical therapy and cortisone injections may be widely available. I'm only briefly going to comment on the second-line therapies of night splints and taping. Night splints place the foot in dorsiflexion during the sleeping hours and adding an extra stretch that can improve plantar fasciitis symptoms. Research studies did show some effectiveness after 2 months of using the night splints, but no effectiveness after 2 years of use. So they're not effective for chronic therapy, and many people in the studies refuse to actually use the night splints because they're relatively cumbersome. Taping of the foot is a second-line therapy for plantar fasciitis that involves placing tape around the foot in a basket weave type pattern that can support the arch and the plantar fascia. Because it requires some technical skill and time to apply the taping each time it's done, this is often not used with the exception of athletes who are taped up during activities that they cannot stop participating in, such as sports. So they may be taped up by their trainer before going out for a run or before practice. But for a standard patient who's not involved in competitive athletics, taping may be impractical. One of the key things to learn about all of the secondary or second line treatments is that none of them were shown to be effective after 36 months. That means for patients who have chronic plantar fasciitis, none of these treatments have been found to really prevent or treat long-term symptoms. And that undergirds probably the issue, which is there is an underlying problem that is causing plantar fasciitis that is not being addressed by any of these therapies. If you have acute plantar fasciitis and you're not prone to having this recurring on multiple occasions or as a chronic symptom, then it may be something that you did outside of the normal, and just resting it and using one of the first-line therapies is going to be effective. But if you have chronic or recurrent plantar fasciitis, that generally is going to indicate there is some type of mechanical or functional issue that is causing excess stress on the plantar fascia, and none of the treatments that are generally considered to be therapies for plantar fasciitis are really addressing that extra stress or what's causing that extra stress. Here's why I get into my opinion, and if you've been on this channel for a while, you probably already know my opinion, and that is there are a significant portion of people in our society that walk incorrectly, putting abnormal stresses on the feet because of the mechanics of the way they walk, not because walking is naturally high impact, but because the way they are doing it is adding extra stress to the body. If that is the case, the only effective long-term treatment is going to be correcting the gait problems that are causing the extra stress in the first place. This is why I teach walking technique and have created a whole series of videos that are available for you on YouTube to try to help people to not only place their foot correctly with minimal impact, but also change the weight effectively so the structure of the feet is lined up with the ankle and with the knees and with the hip, so everything is aligned that keeps the foot in its natural position, so it's not overpronating or collapsing inwards, which puts extra stress onto the plantar fascia.